Pericardium one point to be known as a Tian Chi. Tian Chi. Tian matlab heaven. Tian means kind of the paradise, right? The Chi is nothing but is the pool. Pool means is the kind of the water, kind of the fluid, or kind of the openings, or kind of the place where that the heaven of the heaven is placed on that particular region. If you realize the realistic of the heaven, that to be known as a Tian Chi, that is the pericardium one point. Where exactly this point is located, that area to be known as a one chun lateral to the nipple. The point is located. Lot of secrets or hidden secrets are there. Certainly you can have a look this, and then numerous points are existing. In one line you will get the nearly 14 points, I believe. So in one line, the entire line, how many points are existing? Nearly, I think, 14 points are existing on the one line of this particular area. So let me see. The one point is the Tian Chi. The second point is the Tian Su. The third point is Yuan Ye. The fourth point is the Zhe Jin. And then fifth point is Shenzong. Then the third point is the Shenfeng. So these points are one side, I told you, the other side are the same points. So
even pericardium one is not seen in the screen.
Oh, is it so? Right.
It's a fun.
Yeah, I think I'll show you. This is the nipple region. This is the pericardium. This is the center of the nipple to be known as a, which is the point? This is Ru Chung. Ru means is the breast. Chung means is the center. Ru means breast. Chung means center. The center of the nipple to be known as a the stomach 17 point. Stomach 17 points. We all know this is the forbidden point. Right? This only the anatomical locations to be taken place, but still the Chinese people insert the needle inside the nipple also. But however, we don't want to use it here, but you can use it this point to be known as a Ren, that means stomach 17. Then one chun lateral to the mammillary, rather the nipple is the normal ordinary language, mammillary line or the mammillary gland. So that gland to be known as a nipple, one chun lateral to the nipple. For the male, you can recognize this is the Tian Chi point. For the female, however, you wanted to treat, but that particular time it totally differs, because we all know that the point is located on the which place? Fourth intercostal space. This point is located on the fourth intercostal space. There is the mammillary gland is located, the breast is located, or the nipple is located for the males. When we understand about the females, then it differs. Perhaps it is on the fifth intercostal space, perhaps it is on the sixth intercostal space as well. But however, try to understand, place it like this is the upward direction. No, not this much. No semiflex. No semiflex, yes. Less than 17 years girl, 18 years girl or 19 years girl is okay. But after the marriage, when the woman having the children, 1, 2, 3, 4 children, then the breast is hanging. There is a sagging of the breast is there. That sagging to be taken place in this direction. Then try to find out the breast, the nipple is on the central region of the fourth intercostal space. Then try to find out, yes, the point to be known as a Tian Chi specifically. Otherwise you wanted to do press from the C1, that means is the intercostal ribs, that is first rib, second rib, third rib, then is the fourth rib. Come for the woman, try to find out from here, then 1, 2, 3, 4, then you come to proper location. Yes, this is the point to be known as a Tian Chi, which is called as a pericardium 1 point. But now which muscle this point is located, that to be known as the pectoralis major muscles, the point is located. Once you do the insertion of the needle, then that inside it goes, that muscle to be known as a pectoralis minor muscles. Then further you go to the deep level, so that muscle to be known as a external intercostal muscles. Further you go to the deep level, again it goes to the internal costal muscles. Internal costal muscles. How many muscles are there? 4 muscles are there. So one acupuncture, excuse me,
Rupias, please mute Rupias.
4 muscles are there where that penetration to be below that the cardiac system is existing. So therefore first you insert the needle on the pectoralis major, then you go to the pectoralis minor, then you go to the external intercostal muscles, further it goes to the internal intercostal muscles, but you don't touch to the internal costal muscles, are not advisable to touch to that level. So that's the reason when the person is obesity is there, that time you can use the 1 tune needle. If the person is the emaciated person, then you can insert the needle is nearly half tune to 0.75 tune insertion to be good to treat for the all the breast related disorders, all the chest related disorders, cardiac related disorders, pulmonary system related disorders, intercostalis pain related conditions due to the trauma, due to the injury, having the pain. So that particular time certainly we can use this specific point to treat for the numerous diseases. And also further people wanted to use as a aesthetic acupuncture or the cosmetic acupuncture. Female wanted to use this point. Certainly I wanted to add up 1 point, you just add up the another point to be known as a Tian Su. So Tian Si, that is called as a spleen 18 point, is again 1 tune lateral to the pericardium 1, the point to be known as a spleen 18, you can add up, the point is here. Then further you wanted to use the point to be known as a Shen Feng. Shen Feng is the kidney 23 point, you just add up this point. Further you wanted to add up the Shen Zhang, that is the Ren 17 point. Again you wanted to use the next point to treat for the breast disorders, you can use the Zhe Chin and then Yuan Ye. Yuan Ye means is the gallbladder 23 and then gallbladder 22. Yuan A is the gallbladder 22 and then gallbladder 23 is the say chin acupuncture points. These are the 1 row. If for example, if the breast having the problem related to the BI-RADS, so breast imaging data analytical system, when the BI-RADS 1, 2, 3, 4, 5 having the problem, even for the young generation at the age of 16, 17, 18, 20, 24, 28, before marriage or the post marriage, the woman is suffering for this kind of the problem. Certainly you can use it. These are the points called as a Tian Si in the Tian Chi. These are the most important point to treat for the breast related disorders. So normally you can use the local points, and again you wanted to use as the Ing Chuang Ru Chen Pu Rang. That means the breast related points called as the breast related points which we called as a window of the breast, then the center of the breast and then root of the breast. We do have the points called as a Ku Fang Wu Yi. That means is the stomach 16, then stomach 18. that is Yingchuang and then Rugen. These are the points you wanted to add up along with this Tian Chi point. Always is good to treat for the most of the breast related disorders, especially the people after the master in acupuncture wanted to do as a specialization in acupuncture. The people really, women especially wanted to treat for the celebrities, or some people who are really VIPs wanted to treat for the cosmetology in acupuncture, then definitely you can add up the sum of the points in this region that having the great impact, or bilaterally having the problem, then you can use it. Bilateral points also good, but all the breast related disorders you can use the additional points on the posterior region of the body, that to be known as a Tian Su. That means is the Tian, that point also is the Tian point, that is the small intestine 11 point, you can use it. Small intestine 11 points is the Tianzang. You can use the point is the back of the center of the pit of the scapula. The point is located. You can use the SI 11 point to treat for the breast related disorders, and also the lactation deficiency or the excessive secretion of the milk, or the lactiferous ducts are not opening properly, or the galactorrhea or the hypogalactorrhea, that means excess or the deficiency. All the conditions you can select the point to be known as the pinky finger point to be known as a Shauza, that is SI 1 point. So therefore integratedly you wanted to add up these points will be really helpful to treat for the most of the today required this kind of the treatment to the women and also girls especially, where they will end up. I think one oncologist told me that Byret's 1, 2 is really not much dangerous to the body. If it is greater than goes to the fourth and then fifth Byret's is positive, is indicating is the malignancy also, benign cancer also. So therefore before putting and going forward to the Byret's 4 and 5, then try to complete and treat the problems before the 3 itself. The patient feel that Byret's 1 will be normal. Maybe mild to moderate having the lump, that cannot be considered that there is some problem, because the prolactin level which is connected to the breast, that having some getting changes. So greater than 20, 30, 40, or sometimes it goes to the 60, 90, 100, that having the great impact to cause some kind of the problems. But luteal phase, and also there is the follicular phase, but before 14 days of the menstruation is the different. After the 14 days of the menstruation it get changes. So in that way, so the prolactin level also very important to governing and regulating to our breast system, especially for the females. Male also having that, but it is the minimum quantity, but the female having the more predominantly is taking care for the secretion of the milk and protecting to the mammillary or the breast conditions. But however, if there is a floppy or some kind of the stiffness and rigidity is there, and that particular time you wanted to add up the cupping modalities on that region by using the dry cupping or the massage cupping by using the olive oil, but certainly having the great impact. And girls having that before marriage, they have the very less breast is there, or the size of the breast is smaller than what is required. They have the very eagerness that I need to develop my breast condition. So that time certainly need to be given the massage to that particular region, doing the olive oil massage or the gosha massage. So on that region to the lifting to the upward direction, lateral position and medial position. So that also having the great impact, and using the massage to that region, certainly that having the development of the breast to be taken place. But at the same time is the sagging of the breast is there. So that time we can use the points by activating, which are the points I told you, vicinity of that entire area. You can use it to the upward direction, not to the downwards direction. You can insert the needle to the upward direction, 1 needle, 2 needle, 3 needle, 4 needles to the upward direction. to treat for all the breast related disorders, but not the descending direction that causes the much more problems again. But therefore you can add up, these are the philosophical points, will be really useful to treat for all the breast related disorders, certainly having the great impact. So by the way, the pericardium, remember the name itself is the heaven meridian, and also it gives us a Tian Chi, the point name that indicating is the heaven. Even the meridian also to be known as a sexual meridian itself too can be considered this, or the psychology meridian to be known as a pericardium meridian. In that condition, the breast is the most imperative after the marriage, which is very much essential. There is a feeling or the touching to that nipple area, touching to the areola, touching to that pectoralis major muscles, the patient feel, that means that drastically get changes to the woman, because that directly goes to the brain system. It open up the endocrine system in the brain, that pituitary gland. From the pituitary gland it goes to the hypothalamus. From the hypothalamus it releases certain hormones called as a posterior pituitary hormones, and then anterior pituitary hormones, which is very much essential to regulate the pituitary gland and also for the mammillary gland as well. This having the direct connection to the brain, at the same time having the direct connection to the penile organ of the male, at the same time the vulva, that's called as the vaginal openings of the organ to be known as a vulva. So there also it is getting the erection, that's called as a clit. Clit is known as a G-spot. G-spot to be known as a clitoris. So therefore that activation to be taken place once we activate to the breast region. So therefore very much essential today for the even sexology as a on reproductive health, but which is most required to the preliminary level. After the puberty, which organ will develop? First will develop by the breast itself. So therefore the breast is very much essential to regulate for the overall health conscious related to the sexual health is very important. In that case, once we do the preliminary level, normally we say as a foreplay to be taken place. That foreplay to be touch and feel it. So that erection with how we do get the erection to the male, in the similar way female also get the erection. The nipples are sleeping, so that time it get the roughness and also get the distension and get a swelling, and also it gets the erection. If this gets the erection, then your mind constitution also will become healthy, and then happiness, because people says whenever they do have some kind of the problems related to the mind constitution for the male and then female related conditions, where the woman is not supporting to the husband or husband is not supporting to the wife, so that time people will be get lot of problem related to the psychosomatic related disorders. Even today your anger, furious and resentment, the people will get that kind of the intention because of this is not happening, because there is a Huyin. Huyin is the point to be known as a REN1 point activation to the brain system, that's called as the endocrine system. When the nipple is touches, then it goes to the brain connecting to the Huyin point, that point to be known as the REN1. So therefore interlinked each other. So therefore what is required even for the geriatric old age, where the husband and wife are living together, then certainly just as a pleasantable way, happy way, mood, whatever we do have some kind of the anger or furious, something like that, what is required is the dopamine. Dopamine and oxytocin is required. That oxytocin also to be known as a love hormone. At the same time, dopamine to be known as a happy hormone. Both the hormones to be regulated by activating the single point. So therefore, REN17 is the forbidden complementary point to be known as a Tian Chi, having the great impact to treat for the sexual related problem and also related to the breast related disorders.